when an individual starts showing symptoms, then it's already too late, or you can already see the disease unfolding in the individual's physiology. Healthcare has come short in trying to combine multiple data points that would allow you to understand who has disease progressing in the body.
So is it fair to say that we are just not reporting on data, but we actually helping organizations to act on health risk, because employees can actually prevent the whole issue of sickness and absenteeism?
So we're not only giving a risk score to the patient, we are taking actions on that and ensuring that the patient has a clear, personalized set of recommendations to change that lifestyle that it's been carrying on for a few months or years. Interact with AI, get risk scores, get predictions, and then actually take an action on those risks.
So Ben, nice to have you here with us. And I know you are a PhD researcher at Oxford University, dealing with interpretable machine learning in healthcare. And also you decided to join us and carry on this journey of PremedGo with us. But what I really want to understand is, who is Ben? So if you tell us who Ben is.
Of course, yeah. So I'm a biologist that did my undergrad in Uruguay in South America. And I started working in healthcare, biomedical sciences, because I had this idea that medicine should be preventative above all. You should be able to prevent someone having a disease rather than trying to treat that disease from the start. And so that's why I moved well into my career into Mount Sinai Hospital, where I started working with electronic health records, so the medical history of a patient, and using AI to try to predict who is going to have a disease at some point in their life. And that's been already 6 years of research working in that area, particularly in cardiovascular diseases, and also with a big expertise in genetics. I actually started my undergrad focusing on genetics, which is also, you can see, as a way of predicting who's going to have a disease from the moment they are born. And so from my research at Mount Sinai, I realized that AI can gather information from large databases and accurately predict who is going to have a disease, let's say in 10 years. And that's what's taken me into wanting to pursue a PhD here at Oxford, where I joined a lab that it's also working particularly in cardiovascular disease and trying to build AI models to predict cardiovascular diseases, but also focusing on making those models actually useful for the clinic. So not relying only on making the AI very fancy and extremely powerful, but making things that are also simple enough for them to be applied into the clinic and to actually help patients, predict and prevent their diseases. And within a year here at Oxford, I met George, founder of PremedGo, who introduced me into this mobile phone application that is trying to actually bring those AI models and connect them with the clinical information from the patients to derive predictions that can actually lead into clinical actions and preventative healthcare tests and preventative healthcare recommendations. And that's why I thought PremedGo was a great idea that combines three things that I'm very, very interested about since the start of my career, which are being able to predict who's going to have a disease and prevent that rather than just waiting for the individual to have the disease, but then also being able to bring that solution to as many individuals as possible, and so make that scalable. That's what PremedGo is doing with the mobile phone application, which anyone can download, and also making sure that that is accessible, and anyone who has a need, who has something that is maybe an indicative of a future disease, can log into the app, interact with AI, get risk scores, get predictions, and then actually take an action on those risks and hopefully prevent disease. And that's what PremedGo is doing with its work in Africa as well. So I joined PremedGo very, very, very enthusiastic about the work that we are doing.
Great. So Ben, just a follow-up question to that. So why is prevention such a hard problem for traditional healthcare systems to solve?
Right, that's a good question. And prevention occurs when the individual doesn't have clear symptoms, right?
Mm-hmm.
You would say that when an individual starts showing symptoms, then it's already too late, or you can already see the disease unfolding in the individual's physiology. And to be able to predict who is going to have a disease before those symptoms occur, you need to be able to draw a line from some nuance, you would say gray data point, gray sign of that disease unfolding in the body, to be able to determine this individual is actually having something underlying in their body that hasn't yet derived into a symptom that you can use to diagnose a disease. It's just an underlying mechanism that is going on in the body that tells you there's something going on that will at some point lead to a disease being diagnosed. And to be able to capture all that information, traditional healthcare has come short in trying to combine multiple data points that would allow you to understand who has disease progressing in the body. And nowadays, with digital healthcare system and also wearable devices, and individuals being much more aware about their lifestyle and how does that affect their body, we are able to collect this huge source of information and integrate AI into that to hopefully find slight signs of people getting sick before they actually show symptoms and before it's actually too late to prevent that happening. And so the whole problem about preventative health for traditional healthcare is that they don't have enough data and they don't have any way to act on that data to inform risk and to inform prevention. And that's where AI can be extremely useful, because it can find traces of information in that vast amount of data that tells you this individual is actually having a progression of disease that hasn't yet led to symptoms.
Interesting. So that means that if we had tried PremedGo like 5 years ago, it wouldn't have really worked out. Is it because of the is it to do with technical stuff or clinical stuff? What has actually changed in the last 5 years? What's your opinion on that?
Right. So up to, you would say, maybe 10 years ago, before this whole data bomb, researchers in medicine would rely on trials that just tested a number of clinical markers and seeing how those clinical markers can change when someone is progressing to disease. And that's the traditional ones, like lipids, cholesterol, typical one, body mass index, just, I would say, a handful of 20, 30 risk markers that you can use. And that's very restrictive, and it doesn't capture anything that is non-clinical and non-physiological. What's changed now is that we can, first of all, integrate or compile all that information for millions of individuals in one database that it's integrated with AI to derive knowledge, but then also we can also incorporate non-clinical information, which is medical evidence is showing that more and more that type of non-traditional and non-clinical risk markers are very, very, very important to be able to predict the risk of disease. Things like your microbiota, right? Things like the mental health state of the patient and stress levels and things like that. They weren't really much taken into account before when researchers were trying to predict risk to disease. And that's the key change that, together with the expansion of data, makes this the right moment to integrate AI, to combine all that knowledge and derive risk predictions from that.
That's very interesting. So what unlocked this that simply didn't exist before? What is it, COVID, or what brought about reliance on data shift from this traditional model where we relied on clinical test only to where now AI is becoming something instrumental and important within the healthcare space, mainly preventative health?
That's a good question. So I think there's a lot of things going on that led us to this point, right? First of all, just technological advances of healthcare systems being digitalized, and that from its own side, it enabled us to have these huge databases like the one we can work here. I'm actually working with in my PhD in Oxford, which is, you would say, the UK's electronic health record, which at the time combines the full medical history of over 50 million individuals, and that's just clinical data. And before, you wouldn't be able to have all of that information digitalized, and let alone for that amount of individuals. And so that by itself has enabled us to train AI models on that clinical information. But then at the same time, might be because of COVID, I really don't know why, there's been this trend of patients wanting to get a hold of their healthcare and trying to understand what's going on with their body and how they can change lifestyle to be able to perform better, to feel more healthy, to live longer. Aging is a big topic in medical research now. So I think that combines to the boom in data that we've seen, where individuals are more and more trying to gather non-clinical data from themselves, and that's personalized non-clinical data. And that can be used to take those AI clinical models to a next step and integrate non-clinical data to make extremely personalized AI model that would predict risk. So I think it's a combination of those two things that has changed and has made AI a very powerful tool nowadays.
Nice. So let's make this make sense to business leaders in terms of AI, preventative health, now what PremedGo is actually building. So what are we saying will be the advantage of a business signing up PremedGo for their employees? Are we saying things like it's going to help them stay healthy, but how? Can you tell us the benefits of PremedGo to the end user, of which the business will sort of benefit overall?
Of course. So the way medicine works nowadays is, at most, you have a patient that starting to show symptoms, and then because of that, it goes to the GP and gets into what you would call the clinical workflow of care. And that GP just recommends some testing to be able to diagnose the disease, and then according to the disease, he would start treating it. That is, first of all, very expensive to the whole system, but then also takes a lot of time for both the patient and the healthcare system. And ultimately, because it takes time from the patient, it takes time from the employers who are not relying on that employee anymore, because it's being taken care of by the healthcare system. And so what PremedGo tries to build is this platform where the employees or the patients, they upload their lifestyle data, non-clinical data, to the app regularly, as much as they can, daily, weekly, as much as they can, to build this data profile of how is their lifestyle and how that might impact their their state of health, and combine that with their medical history, clinical information, all of the diagnoses that they had over their lifestyle, and also their family history of disease, which is very important to build this profile of the current state of health of the patient. And that would enable us to derive risk predictions for a number of very common diseases. And so the patient, as it's integrating data into the app at some point will highlight that the individual is at risk of one of these very common diseases and derive the patient for testing. And so once the testing is done and the risk of the patient for that disease is established, then PremedGo provides this whole set of personalized recommendations to avoid the individual getting sick in the first place. And, well, first of all, stay on top of the health of the individual, so the individual wouldn't get sick, but also the employer wouldn't need to get that employee on sick, and it would just keep on working for the company. So it's a win-win for both cases.
Interesting. So is it fair to say that we are just not reporting on data, but we actually helping organizations to act on health risk, because employees can actually prevent the whole issue of sickness and absenteeism?
Definitely. So we're not just relying on the data that the patients give us to, well, tell someone that they are at risk of something. We are going a step further on that. And from finding risk in an individual, we are first of all deriving them to a test that would definitely ascertain the risk of that disease. And once that risk is established, we come up with these recommendations of lifestyle changes that only PremedGo can derive in a very personalized manner, because PremedGo has the information of what that patient or that user has been, how the lifestyle of that patient or user has been in the past few months or years or whatever, and exactly what things need to be changed in order to prevent the disease that it's progressing. So we're not only giving a risk score to the patient, we are taking actions on that and ensuring that the patient has a clear, personalized set of recommendations to change that lifestyle that it's been carrying on for a few months or years to bring that risk down.
Interesting. Thank you. So from a user point of view, where does the AI actually show up? And I know you're building with a team, but if I'm a user, where will AI show up? And how is it different from a normal traditional digital health platform?
Okay. So for the user, the individual interacting with the app, the AI you could see it as a way to derive knowledge from everything that's going on in your body, essentially. So first of all, and as a background, as a very solid background, we have the clinical information. And you can already derive a lot of knowledge into what's going on in your body with that clinical information. And you can access that from your medical records. But what PremedGo brings in that it's very unique is a platform where you can integrate anything that is also non-clinical. And so for the user, that would mean constantly, daily, weekly, it really depends on how committed is the user to actually staying on top of their health. The more data they input to the app, the better. But it gives the user a platform where they can record all of that non-clinical information. And by non-clinical information, I mean, first of all, nutrition. We're not talking about just what did you have for dinner. We're talking about extracting from that one dish a quantitative numbers of how much protein, how much fat, how much carbs did you have in each one of your meals. And integrating that kind of non-clinical information with things like measurements from wearable devices, if the user has also quantitative data on physical activity, a sense of stress levels and emotional well-being for the user, air pollution, which is a very important risk factor, things like that. PremedGo would give the user a unique platform where they can include upload of all that data and derive from that non-clinical information combined with the clinical information extremely personalized risk predictions that are obviously informed by what's been their lifestyle like in the last few months. Okay. And so the AI within that, you could see as a pool of personal data, the AI would serve as just a tool that is able to interpret all that data as no one else can. And the AI would derive from that combination of things you've been eating with how stressed have you been, and combine that with some clinical diagnosis that you had in your life, highlight a risk for certain condition. And because the app already has that lifestyle information, it can crucially derive specific lifestyle recommendations to bring those risks down.
Interesting. So the AI is not, it's looking at lifestyle plus clinical data, isn't it? Not just your past historic, but it looks like at your present as well. So maybe things would have changed, isn't it?
That's a very crucial part of why what we are building at PremedGo is unique.
Interesting. That's truly unique. That's interesting. So just want to dive down into the scientific bit. So one concern people have, which I think you know from articles and a lot of social media platforms, will be AI in health. And then people say that AI in health is a black box in terms of decision making. So how are we designing PremedGo so its recommendations are explainable and defensible?
Right, crucial. That's crucial for any healthcare AI startup, and it's at the core of what we are building.
Interesting.
And so, obviously, to make something robust, it takes time.
Yeah.
And what we've designed at PremedGo, it's a long-term plan, where we, at the beginning, rely on AI just to perform non-clinical tasks, and have a long-term vision of validating an AI tool to actually derive clinical tasks. And by this, I mean we're first going to have conversational AI models, things like ChatGPT, things that anyone has been using to interact with the patient and gather information from the patient that combines that, as I mentioned, non-clinical information with the medical records and the clinical information from the patient. And with all of that, gather data from reputable sources, and that would be things like NHS documentations, NICE guidelines. In the US, there's the USPTF Preventive Task Force guidelines that have very specific, robust, and clinically validated recommendations for a certain set of conditions and patient characteristics. And so what we will be doing at the beginning is just matchmaking those, right? So the clinical information from the patient with what actually doctors, GPs rely on, which are the guidelines to derive recommendations. So at the beginning, we're going to be relying on the AI just to matchmake those. As that rolls out into the app and enables users to benefit from personalized recommendations, we would be building these proprietary LLM models to derive preventative medical knowledge and preventative recommendations, together with a more risk specific GPT model. So it uses the same AI infrastructure as ChatGPT, but it's not a model where you would conversate with it. It's not a model that you would chat with it. It's just a model that would see all of your information and derive risks from that. So we will be building both the conversational kind of ChatGPT model that drives medical knowledge, and then also this also GPT-like model that derives risks. And as we build those, we are going to go on to clinically validate them, both with scientific publications, crucial, and that's something that we are very used to here, obviously, with my PhD here in Oxford, my time in Mount Sinai, and so that's something that I want to bring to PremedGo, scientific rigor, and having whatever we do published in an academic journal, and also with a clinical trial, ultimately, which, because PremedGo interacts directly with the patient through the app, is something that we can definitely do at scale. And so we are only going to bring the medical knowledge, the medical AI decision making to the app when those two are ready, verified, and you would say clinically reliable, having an academic publication and having a clinical trial done on the AI. And that's where the AI knowledge, AI-derived recommendations are going to step and replace the guideline-derived recommendations. So at all points, the AI that goes into the app is built upon robust and clinically validated information, either by the guidelines or either by a clinically validated AI model.
That's I think that will instill a lot of confidence
in
people who are skeptical about AI in healthcare. So that's quite good. Yeah. That's very detailed. Also, what academic or clinical standards are we benchmarking against? And perhaps maybe you won't not be able to tell us exactly, but I know you've done some publications as well. So if you want to talk about that.
Of course. So it's different when you benchmark a conversational model like a ChatGPT model versus when you benchmark risk score model, like the GPT-like one that I mentioned earlier. And so for the conversational model, we would be first benchmarking against databases of conversations of patients with preventative healthcare practitioners, as a way of retrospectively evaluating the model. And when we say retrospectively, we mean from this time point, we take data that has already been collected and see how the model would have performed in those individuals that have already been collected. And then once that is validated, and that would lead hopefully to academic publications, we would go on to evaluate the model prospectively. And that means just roll out the model in a pilot trial and see how the model interacts with the patients, and also how accurate are the predictions and the medical recommendations that the model brings to the user as it's being used in the app. And that means prospectively. With that data coming into us, we're gathering that data as the clinical trial progresses, we are going to be able to determine the performance, obviously, of the model in that set of period in pilot trial. And the same applies to a risk model. You would use, in this case, establish medical records from individuals, and they're linked to whatever diagnosis they had, and test that model retrospectively in that database. And same thing prospectively, you would roll on the model in a pilot trial and see how that model performs as the clinical trial progresses.
Interesting. So regulation scares a lot of startups, and especially myself as CEO of PremedGo, I'm really scared when it comes to regulations, actually becoming a barrier to advancement of AI in healthcare. You've taken a very positive view that getting this right early is a competitive advantage. So why?
So yeah, regulation is crucial for any healthcare AI startup. That needs to be taken seriously, right? So what we are building here is ultimately going to be used by individuals to act on their health, and whatever mistake the AI does is going to impact the healthcare of an individual, right? So that's something that needs to be taken very, very seriously. And we are making sure that the AI model is in line with whatever regulations need to be taken in place for whatever country the AI is it's integrated in. And that means that for now, the AI will never by itself, by its own, impact the decision of a user on its clinical output. So at this point, the AI only provides recommendations based on the guidelines, right? So it's ultimately up to the user if it relies on those recommendations to book a test or to change its lifestyle. And the good thing is that the regulatory bodies are starting to see the true impact of AI in healthcare. And because of that, they are starting to, you would say, relax a bit of the regulations. And interestingly, last week, the FDA changed the requirements for AI to be deployed in healthcare companies. And it changed from something very restrictive, where the AI couldn't at any point influence the decision making of a doctor, to just making sure that the prediction that the AI is deriving can be interpreted by the doctor. And so as long as the doctor can go over the reasoning that the AI did and understand why it came up with that prediction, the doctor can rely on that prediction to actually recommend a clinical action to the patient. And so that's, I think, points out to where these regulatory bodies are going to. That happened just last week in the US, and most likely all the regulatory bodies are going to follow that decision, where it makes any company, including incorporating AI into their system, much easier to comply with, right?
Interesting. So on my MSc program, I think we had a debate, and I think the program is full of doctors and clinicians, so you can just imagine a debate on AI. And I think one of the bits that always comes up every time we have a debate with clinicians is, how do we prevent AI from overstepping into like unsafe territory? So in this instance, how do you prevent it from hallucinating and just saying something out of the ordinary? How do you do? Yeah.
So that there's obviously a lot of safeguards that we incorporate, or we are incorporating into the AI that we are building, to make sure that the AI stays in line with what we want it to do, right? So crucially, at this early stage where the tool is not clinically validated, we don't want it to prescribe anything or diagnose anything. And we also want it to escalate any conversation that is showing red flags and things that might indicate that the patient is very sick and needs emergency care.
Interesting.
And so for that, we are building what you call a constellation of multiple AI agents, where some of them make sure that the conversation stays in line with what we feel safe with the AI doing, which is in this case not relying and not deriving any prescriptions, not coming out with any diagnosis. And then also other groups of agents that are tasked with finding red flags and escalating individuals that show symptoms that need emergency care, and deriving those to calling 999, for example. So we are taking care of that by building this constellation of multiple AI agents until we make sure that the model is clinically validated.
Perfect. I think that instills a lot of confidence in users. So my next question is on differentiation. So I know we are unique. I know there are loads of AI platforms emerging. What will you say is the philosophical difference between how we are building PremedGo and how approach this same space?
Okay. So I think what really makes PremedGo unique compared to these other healthcare AI startups is that we are trying to provide the user with this platform where it can just dump all of its healthcare information, and that's clinical and non-clinical, to have AI inform on that. And as the user interacts more with the app and as the user inputs more information into the app is ultimately going to turn into that one, you would say, personal doctor that knows everything about you. It even knows more about you than a GP when you go and see the GP, because when you go and see the GP, it might have access to all of your clinical information, not certainly, but might have access. And then you would have to narrate whatever has been going on with you over the last few weeks, and whatever you remember, and also whatever you remember at that specific consultation, right? With PremedGo, you don't have to take care of that. You just input the data daily, weekly, whenever you feel confident with. And the app is going to store that, and it's going to constantly learn patterns from that to derive risk predictions. And so I think that's what makes it unique and different to whatever anyone else is building.
Interesting. So fast forward 3 years from today, if PremedGo has done exactly what we hope it will, how will the organization be making health decisions differently?
So health decisions in preventative healthcare.
So in preventative,
they are derived from traditional risk factors nowadays. And that's just broadly things like age, gender, things that are very high level, you would say, and are not very granular, specific to whatever is going on underlying in that patient. Because PremedGo is gathering this non-clinical information from the patient, it will be able to train these AI models that are only you're only able to train them if you have this data, right? And so because they combine data that is clinical and already available to most healthcare startups with non-clinical data that it's only available to PremedGo and the users that input that data, in 2 to 3 years, PremedGo is going to be able to derive these risk predictions that are extremely personalized for each user, because it has been building this unique database of non-clinical information, combining it with the clinical information from the patient that is derived from their medical records. You get that from the providers. And that makes the risk predictions that you can get at PremedGo, first of all, unique because they are derived from lifestyle changes, lifestyle information that can be used to inform lifestyle changes and lifestyle recommendations. But then also much more, hypothetically, much more precise because it integrates a broad set of information that gives us this holistic understanding of the state of health of the patient. So both very personalized, unique, and extremely precise.
Interesting. And I think you mentioned something about being scalable. So does that mean, and especially if it combines clinical information with lifestyle information and the person keeps on interacting with it and building that, are you then saying it can be used anywhere as well? So I know we are also looking at Africa, where we've started with Ghana piloting successfully in Ghana. So in urban Ghana, I think would work. Are you also saying in rural areas where they have limited access to healthcare, PremedGo can be the solution?
That's exactly. So that's one of the things that I think is really, really interesting about what PremedGo is building, is that because it all works within this app, this mobile phone, and nowadays anyone has mobile phone.
Yeah.
And it's a way of getting into these very remote areas where they don't have any access to healthcare, and they do have a very risk adverse, you would say, lifestyles. And so with the combination of clinical and non-clinical information, clinical and lifestyle information within the app, we can provide this service ideally for free to remote areas of Ghana or any African country, where individuals would upload their lifestyle only information and provide with AI-derived risk predictions and changes on that lifestyle that would prevent them from needing access to healthcare, which is a huge change for these communities where accessing any type of healthcare is just not possible. So what PremedGo gives them is a means to understand what changes they need to make in their lifestyle to avoid needing healthcare.
Interesting. So my final question for you is that what becomes obsolete in healthcare once that happens, in terms of once PremedGo is up and running, 3 years down the line is all built, what do you think will be obsolete in a positive spin in terms of us as individuals? How will we really benefit from that?
So first of all, I think the whole process, very time-consuming process of booking a consultation with a GP and having to explain all of your symptoms and whatever you've been feeling, and having a test prescribed or recommendation based on that, that whole part wouldn't be necessary anymore, because the individual would constantly input data into the app. And so the app will already have an understanding of your entire medical history and your past recent lifestyle. And so that by itself takes makes obsolete something that is very much a burden for both the healthcare system and for the user. But then at some point when this becomes established and it's validated, clinically validated, then the recommendation as well might become obsolete. You would have the AI provide recommendations on lifestyle changes that wouldn't need to go through a GP. You would just need to consult a GP when symptoms start to arise, which is actually the standard of care now. So PremedGo would take care of staying on top of your health in all of that stage before developing symptoms, all of that preventative realm of preventative healthcare. And so I think, that's where PremedGo can be extremely useful in a few years, 3 to 4 years.
Interesting. So how I understand and summarize it is that PremedGo will give us like a 24/7 personalized sort of GP who can sit alongside our GP if things escalate. So as an individual, I don't have to worry about getting appointments to see my GP for basic stuff. So I only see my GP for things that really escalates. That's very interesting.
So I was talking to preventative GP, you would say. So he's a medical doctor, a GP that takes care of doing these preventative healthcare consultations. And he was telling me that the kind of patients that he gets in the preventative healthcare consultations are very different to the ones that he gets in the typical GP consultations, because you usually go to a GP consultation when you have something that you think is worth going for, right? And you're feeling very bad about this. It's affecting your life, your daily life. But you wouldn't go to an actual GP for something that you think is just a bit worrying a bit or bothering a bit. And that's the kind of information that is crucial for preventative healthcare. And so what PremedGo is providing is a way of actioning on that, incorporating that into the app, having the AI interpret that, and then deriving recommendations based on that. Things that you wouldn't ever mention to a GP.
Interesting. And to close it off as well, I think one bit you mentioned was, which is quite interesting, is that it's not only looking at historic data, but it's looking at your current lifestyle data, because people change over time. So it's very interesting what you lead in terms of the AI build here, PremedGo. So thank you very much, Ben.
Yeah, that part is crucial, I think, for what we are trying to build, because the fact that we are collecting that present data, that current lifestyle information, is what enables us to derive specific personalized changes on that lifestyle that would bring that risk of disease down. So it's a crucial aspect of what we're building in PremedGo, combining that with the clinical information.
Thank you. Thank you very much.
Thank you, George. Very nice chatting.